Hi, this is Dr. Doug Lucas. I wanted to do a short introduction to the talk that you're about to view on this video relating to sleep, the immune system, and health. We begin by talking about some of the basic statistics of sleep, kind of the details of what deep sleep versus REM sleep and what all that means. And then we dive into the disturbing statistics on short sleep and sleep loss as it relates to the immune system and the metabolic system of the body, particularly with weight loss, weight maintenance. We then get into, at the end, some discussion of sleep hygiene and some ways that you can try to improve your sleep. And then we talk a little bit about cognitive behavioral therapy for insomnia if those tips don't actually provide you with some relief. So I hope you find this helpful. It is relatively long. You can skip through. Again, it's sleep, immune system, um, uh, the metabolic response to short sleep as it relates to weight loss and weight maintenance, and then the sleep hygiene stuff is at the end. So I hope you enjoy. We're always looking for feedback and requests for other information and topics that we could bring to you through this format. So please leave us some information in the comments. Thank you. This talk officially is on sleep for health and immunity. And I want to thank you guys for your time tonight. I hope you find this helpful. When I did the research on this topic initially, this was a couple of years ago, I did my first talk on sleep. Really blew my mind as to the benefit that we are not getting when we abuse sleep and don't see the need for it. And there's a lot of reasons why we do that, and we'll talk through all of that. So here we go. A little bit about me for those that haven't met me or read about me through PhD. So I'm a board certified orthopedic surgeon by training. I'm still practicing. Um, my subspecialty is in foot and ankle. I am practicing part-time now so that I can focus my full-time attention professionally on PhD with my wife, Dr. Ashley Lucas, the founder of the company. The reason why I made that shift is that as a foot and ankle surgeon in particular, I saw a lot of people that were dealing with obesity, diabetes, neuropathy. And what I found is that so many of them had problems that I didn't have an answer for. There are some very clear things that orthopedic surgery can do very well, but for so many people with foot and ankle issues, their issue is the metabolic side. They are sick for other reasons, and when I saw the tremendous change that could happen with the right avenue of weight loss and changing their metabolism, they got better and didn't need my services. So we've been able to now make that shift. So I'm playing a bigger role to help bring this to more and more people. So my now current role is the Chief Science Officer, with the whole goal of digesting and disseminating research and information. And Dr. Ashley Lucas does a great job, but the medical knowledge overall is doubling every 73 days. If you think about that, that is a tremendous amount of information. The number of studies and research and books and everything that comes out is too much for any one person to handle in any subspecialty. And we feel that it's so important in this field where it's getting more bigger and bigger, but better and better as we move forward. I mentioned this earlier. This is where this information is going. So this is the research corner of our website. It's under research. If you can see, let me get my laser pointer. So if you can see up here, if you click on this, it'll bring up research or blog, and you can go to the research corner, and that's where you'll find these videos and other blog content. So I am an owner of PhD. You'll hear me talk about it. That's not why I'm bringing this to you. My goal is truly to bring this to as many people as possible, and that's why all the content that I do is free on the website. Just try to get people on the website to get this information. Quick medical disclaimer, because I am a practicing physician, I have to say this. No doctor-patient relationship is formed by me giving this talk and you listening to it. This does not constitute the practice of medicine. I am not making recommendations for any individual. You must use your team, consult your physician prior to making any change for medications or other habits related to your medical conditions. And PhD Weight Loss does not staff a physician for clients. My role is to educate our coaches, educate our clients through this kind of a platform. I do not actively see clients through the program. All right, now on to sleep. So sleep has been around as long as we know that animals have been around. So 3.5 million years. All of all animals have been living with sleep and changing the way that they sleep. It has evolved with us over the last several million years and hundreds of thousands of years. Our modern human culture has kind of abandoned this biologic mandate. We've really taken it and abused it to something that it's not supposed to be. In 1910, the average American slept 9 hours a night. It's amazing, blows my mind, sounds great. In 2013, the average was 6.8, with over 40% of those people saying they sleep less than 6. And I think that's pretty common amongst professionals. Granted, I'm in the medical field and we're pretty notorious for that. But this isn't just us in America. This is 2/3 of the adults in the world fail to achieve 8 hours of sleep for a lot of reasons. So this is a study that looked at that trend from 2010 to 2018. So if you look at the prevalence, it's really gone up now from almost 31% to coming up on 36%. But if you look at the categories that we're seeing this in working adults, 50% of protective services and military. So these are folks that I would want to be well slept. I would want these folks to have their wits about them as they're going about their job. Healthcare. All right. I know that field is near and dear to my heart, and sleep deprivation is, I'm surprised 45% said yes. I think it would be much higher than that. 41% of material movement. You know, these are folks that are driving dangerous vehicles. We want them to be well rested. So ultimately, humans are the only people. Sorry, I got to get you guys off my screen. Humans are the only animals that intentionally deprive themselves of sleep. There we go. Now I can see. The World Health Organization has described sleep loss as an epidemic, and sleep deprivation is actually lethal. So the Guinness Book of World Records has actually disallowed attempts to break the record for sleep deprivation because it is so dangerous. Drowsy driving, which is something that I never really paid attention to or heard anything about, and still don't now a couple of years later after learning a lot of this material. Drowsy driving is a big deal. One person dying every hour in the US due to a sleep-related traffic accident. These accidents actually outnumber those caused by alcohol and drugs combined. I'm going to say that again. Vehicular accidents caused by drowsy driving exceed those caused by alcohol and drugs combined. Pretty incredible. If you don't think that it's people that are missleeping a little bit or missing an hour here or there, consider this study looking at daylight savings. A single hour shift in your sleeping habit will have an increase in fatal car accidents and an increase in heart attacks. Just a single hour. And this is all across the country in this little experiment that we call daylight savings times. So sleeping less than 6 to 7 hours a night, which is the definition of short sleep, and some people will say less than 6, some people say less than 7. You'll see some studies that I'll talk about that use less than 4. That's pretty dramatic, but sleeping less than even 6 to 7 hours a night has a tremendous impact on the immune system. Over doubles your increase in risk of cancer, increases your risk for Alzheimer's and dementia, increases your cardiovascular disease progression, and contributes to psychiatric conditions, as well as weight gain and failure at attempts at weight loss. So all those things are very, very important. I could talk about each one of these for a long time, but I will try to cover these topics for today. So why do we ignore sleep? Well, the reality is we don't really know why we sleep. You know, it seems like if there's anything that I can cut out of my day, I'm going to cut out sleep because all the other things seem more important. But we have these biologic mandates. We have to eat at some point. We have to eat something. We have to drink something. We have to reproduce if we want our species to continue forward in time. Sleep seems like the silly fourth one that we don't really need to do. We know we need to do it a little bit, but we sure feel like we could probably do without it. And it kind of appears silly because you really can't eat, drink, or reproduce while you're sleeping. You can't protect yourself. So is it an evolutionary mistake? The fact that every animal, insect, everything that we know of sleeps, I have a hard time believing that that's true. So let's flip to the immune system. So the immune system is very complex. Each line of the immune system, you could talk about in great detail, the innate, the adaptive, all of these different cells. It's pretty amazing. Each of these cells that you see in this picture play a different role. All of these cells are related to the strength and robust nature of your immune system. Sleep, as we'll find out, restocks, restores, and prepares your immune system for battle. And the immune system, a lot of people think, oh, it's just when I get hit with the flu or, with SARS-CoV-2. It's not that. Your immune system is constantly fighting. Your immune system is constantly being bombarded with invaders. The other thing that sleep does in relation to the immune system is it resets the sympathetic tone. And we'll talk a lot about the hormone or the hormetic response of sleep, and how it changes the hormones in our body. But the sympathetic tone is something that is related to chronic stress. Chronic stress is probably the biggest killer in our and most modern societies. And sleep allows you to really dial that back, and that plays a big role in your immune system too. So this is an interesting study I found in preparation for this talk. So this was published in 2015. So this was 150 volunteers. And again, these are volunteers that were followed for, I believe it was a week before inoculation. And then they were injected with a spray in their nose of a rhinovirus, which is a common cold, very similar in some ways to coronavirus. Then they were observed afterwards for sleep. And what they found is that people that slept less than 5 hours versus people that slept over 7 hours, and in a linear relationship in between, more people that slept less actually got the cold. And so you can see the numbers here, almost 45% or so people that slept less than 5 hours versus less than 20% of those that slept over 7. So a nice linear relationship there, relatively well-controlled study, probably something to that. This study on the influenza vaccine is interesting. So we all, well, we don't all, we're all told we should get a flu vaccine. Many of us do, particularly in the healthcare field. I've found that in the late years that I've been getting a flu vaccine, I think I've actually had the flu at least 2 times, and I don't like to get the flu vaccine. One of the things that I think is interesting about this study, it would demonstrate that if you sleep poorly before you get the flu vaccine, which I used to do a lot, it'll actually limit the benefit of the vaccine. So what they looked at in this study, it's actually hasn't been published yet. This was just published online. 83 adults, and they kept a 13-day sleep diary, and the vaccine occurred on day three. So those that had poor sleep developed fewer antibodies. So what that means from a scientific standpoint, the more antibodies you have, the more robust your response will be if you actually get exposed to the virus, meaning that the more robust your response, the less likely you are to actually get sick. So at 1 and 4 months, there was a significantly less response from an antibody standpoint for those that had poor sleep. So it might be that maybe the vaccine was doing exactly what it should, and it was me that had poor sleep a couple of days before or the day before, and I generated my own poor response. So there are a lot of metabolic benefits. We're going to shift now from immune to more the hormone response and the metabolic response to sleep, and how it mostly relates to weight gain, but also prediabetes, diabetes, and metabolic syndrome. So when you sleep, you can rebalance what's called the insulin glucose homeostasis. And don't worry, I'm going to explain all these things. This is just an introduction. Sleep has a huge role in regulating appetite, has a tremendous role in improving your food selection. We'll talk about why. It improves your gut microbiome, which we're learning more and more about. And there might be a tremendous role in gut microbiome to maintaining weight loss and many other things, which we're all learning more about. So the 3 pillars of health. We've heard about the 3 pillars of health: nutrition, exercise, sleep. It's like a dogma. This is how I used to look at the 3 pillars of health, but I always sort of prioritized, for me, exercise. I love to exercise. I've always focused and been interested in nutrition, but I've sort of considered almost a separate entity. And I have sacrificed my sleep in order to focus on exercise because we live such demanding lives. So a lot of people I know will get up early to get to the gym or do their bike ride or whatever at 5 a.m. before they start their day. They're sacrificing sleep in order to do that. And after doing all this research for this talk, what I realized is that we really should probably look at this like this: that sleep is the foundation upon which both nutrition and exercise are built. And without quality sleep, you can't do either one very well. So we'll talk a little bit about the different parts of sleep. We don't need to get into the nitty gritty on this, but what I'd like to point out, this is a graph, this big picture. This is a graph that I get a readout on of my sleep every morning. I use this device called an Oura ring, and I'll go over that at the end. But it's Oura, Oura. It's this black ring on my middle finger and my right hand. it gives me this data by recording all these different things while I sleep. What you're looking at here, if you look here, this says REM sleep. So that stands for rapid eye movement. That's up here, these light blue bars. This one in the middle, this is light sleep, and then there's deep sleep. Both of these two make up NREM sleep or non-REM sleep versus REM sleep. All of these three different things play a different role. So deep sleep, which is this dark blue stuff, deep sleep is when you are restoring your immune system. It's when you're repairing your body. It's when your brain is literally doing the rinse cycle to get ready for the next day. If you don't get deep sleep, you do not do very well. The REM sleep is mostly, and there's a lot of crossover, but it's mostly consolidating memories, taking your social experiences and putting them in the right place. It's almost like a data dump in some ways from short-term memory to long-term memory. Without REM sleep, which you can see is biased here towards the end of your sleep cycles, without REM sleep, you have memory issues, cognitive dysfunction. You may have psychiatric problems. You may find that this is more common in people that have things like ADHD, bipolar, schizophrenia. There's some really interesting associations from a psychiatric standpoint. And we'll talk more about this. But for me, this is a really good night of sleep. Go to bed at 10:30, get up at 7. For me, that's a solid 8.5 hours. That's about as good as I get. All right. So the metabolic side of obesity, prediabetes, and diabetes. I like to look at these things as related to insulin. We don't hear a lot about insulin unless you are talking about diabetes, but I think it's important that we realize that it's not just diabetics that have to worry about insulin. The insulin problem happens way before that. And I like this very simple spectrum, and these are made up numbers, but I like this simple spectrum because it demonstrates that the insulin problem starts before you even have metabolic syndrome, which is what leads to prediabetes and diabetes. Just the weight gain of being overweight and obese can be an insulin problem. That then can then progress into metabolic syndrome, prediabetes, and diabetes as your insulin levels rise and rise and rise. Diabetes is when your body can no longer accommodate for that rise in blood sugar and insulin, and your insulin can no longer keep up and your blood sugar rises into levels of which you have to start taking medications. So we're going to talk a lot about insulin and how it relates to sleep and other things associated with weight gain. So these next three studies demonstrate this association of short sleep duration with these different things. I'll say very quickly that an association is only an association, and you can't say that it causes it, but it may be associated with it, and it is something that should be looked at if it continues to come up. So this is a study demonstrating obesity associated with short sleep in 200,000 participants in 11 studies. This is another meta-analysis of 10 studies of almost 100,000 people demonstrating short sleep with metabolic syndrome. And this is short sleep with type 2 diabetes. So the association appears to keep coming up over and over and over again. It's something that should be looked at. Some additional associations that you find with short sleep and obesity, diabetes. These are things like heart attack, stroke, hypertension, really all-cause mortality, as it turns out, immune system dysfunction, and Alzheimer's and other forms of dementia. All of these things have a basis from a hormonal standpoint that can be not necessarily tied exclusively from a causation standpoint to sleep, but can be related to sleep. How is that possible? Well, there's these clear metabolic pathways, and this is one of them. We don't need to get into the nitty-gritty on this, but this helps explain some of the hypertension that can be associated with sleep deprivation, which can lead to heart attack and stroke. So this idea of, again, this increased sympathetic tone, this chronic stress, the fight or flight that should ebb and flow in our modern day lives is here chronically. That leads to an increase in heart rate, an increase in blood pressure, and poor sleep. So when you have poor sleep, as we'll find out, you increase more cortisol. That's a stress hormone, which causes a further constriction of your blood vessels, as you can see in the picture, which will make your blood pressure go up even more. Growth hormone, which you need to help repair your body. It's secreted during that deep sleep time. If you don't get good deep sleep, then you don't get growth hormone and you can't heal your body. And then those vessels don't get to relax. Those muscles become fatigued. That can assist in leading to atherosclerosis, which is hardening of the vessels, and heart attack and stroke. So this is one pathway. There are certainly other factors in there. This is one metabolic pathway that can be explained and associated with short sleep. So on to weight management, and obesity. So there's this thing called the energy balance hypothesis, which a lot of other people will call it a calorie is a calorie. This is something that in my generation, I was brought up in, and this is why, from a dietary standpoint, we were afraid of fat for so long, because it's so dense. So I'm going to run through this as quickly as I can, but it's important as we start talking about the hormetic response, the hormone response, and sleep. So as quickly as I can, energy balance says that if you eat too much and exercise too little, you will gain weight. People that believe this and preach this will talk about the first law of thermodynamics. This is a law of physics that is absolutely true, and you can't argue it. However, you can argue that it relates to this problem. And what this says is that the total energy of a system is constant, and you cannot create nor destroy energy. In other words, a calorie is a calorie. Clearly, this isn't true if you just take a step back and say, all right, if I have 500 calories of broccoli and I have 500 calories of fudge brownie, ice cream, these are not the same thing. And if you eat them independently for a long period of time, you will not have the same response. So just my gut instinct tells me that this is probably not true. And if you go back and look at the basis of the energy balance hypothesis, or even the first law of thermodynamics, you can see how they've really extrapolated one to meet the other. So again, the definition from a physics standpoint is this change in an internal energy of a closed system. So the body is not a closed system, first of all. And then it says that it equals the amount of heat supplied minus the work done. That's where they get calories in, calories out. If you want to extrapolate that, you could say changes in the body equals calories consumed minus calories expended. But the reality is that that's assuming that those are independent variables and that they are not related to each other in any way. And the reality is we know that they are, and I'll give you some very clear examples of that. So let's talk about child growth. So I have a 7-year-old and a 6-year-old and a 15-month-old. They're all growing. And are they growing because I'm feeding them? So let's look at the equation. So if you say change in their body, growth, vertical growth, change in their body, what's happening there? Are they eating more? Sure. Are they active? Absolutely. So is it the increase in their food that is causing their growth? Probably not. I think that I could probably starve them and they would continue to grow, maybe not quite as much. Is it the exercise? If I exercise them more, will they grow less? Probably not. So it's really the change in the body that's driving the hunger. It's driving how much they're consuming. And to some extent, it's also driving how active they are. So child growth is not related to the food that they're eating, although I would argue the quality of that food matters. What about exercise? What if you just look at the W in that equation? If you say, well, I'm going to increase the amount of energy out, will that reduce a decrease in my body mass? And I think most of us know that that's probably not true. And there are many, many studies which demonstrate a failure to lose weight with exercise as your intervention. Exercise is a wonderful fitness tool. It is a terrible weight loss tool. And in fact, it actually gets in the way of weight loss. But if you look at just the equation, you say, well, if this stays the same and this stays the same and this changes, then this must go down. It's just not true. So I would argue that really we should look at this like this. Changes in the body equal hunger, which is hormonally driven, minus your basal metabolic rate, which is the amount of energy you burn just being you without exercise, plus your exercise, plus things that you excrete out of your body without burning. Ultimately, we're not stoves. We don't burn food. We metabolize food. When you metabolize something, it's different than sticking it in a stove and lighting it on fire. So all of these things, hunger, BMR, exercise, and to some extent excretion, are driven by hormones. So my opinion is that it is a hormone-driven experience and that we need to change the way that we eat and our lifestyles to manipulate those to the best of our ability. And I'm not talking about taking hormones, I'm talking about changing our habits so that we can manipulate our hormones in our own body. So if you don't believe me, and that's fine, but let's look at some studies that try to prove that the energy balance theory is correct. So the Women's Health Initiative, this was a study that was published in 2006. There's a lot of studies that have been published off of this data. The data actually was accumulated, I believe it started in the late 80s. But they looked at 50,000 women, and there was a dietary intervention component of this that focused on a low-fat diet. they wanted them to reduce their calories by, on average, 342 and increase their activity by 10%. They followed these women for 7 years, and they did, for the most part, report that they followed these instructions. And as I said, this was a low-fat diet, so they tried to decrease their fat to 20%. They missed that mark, and I believe it was around 24% what they reported. If they had done that the way that they were supposed to, with a calorie being a calorie, they would have lost 32 pounds per year. 32 pounds per year. Now, most of these women probably did not weigh over 200 pounds to start with, and they certainly didn't weigh less than 200 pounds when they were, or sorry, they didn't weigh less than 0 when they were done. So clearly there's a difference between a calorie as a calorie. After 7 years, the reported weight loss, or actually measured weight loss, on average for the intervention group was around 0 pounds. It was actually just slightly over 0 pounds. But still, 7 years of intervention, it produced no benefit from a weight loss standpoint. There's another study in 2015 looking at a retrospective review of medical records recommending dietary lifestyle change to this effect, and found that if your BMI was in this range, less than 1% of people were able to get their body weight back to normal. And if your BMI went over 40, it was even more abysmal than that. So clearly these recommended guidelines don't work for most people. Now, this study I love. I actually wrote a blog post on this. It's on the Research Corner now. You can go in and look at it. Actually, it talks about all the details of the study. But the short version is The Biggest Loser. We all know this TV show. There's a new season on, probably still on right now. But it is the ultimate. It's the American version of eat less, move more, take it to the extreme. So these participants were reduced in their calories from about 50 to 70% of normal for them. And then they worked out 2 hours a day with an effort to maintain their muscle mass. Very reasonable. They did lose weight. They lost over 120 pounds on average over the 6 months of the course. Their basal metabolic rate, which I defined earlier as the amount of energy that your body burns just being you lay in bed all day. And it varies for a muscular male. It's around 1,500 calories. It could be, 900 calories if you're a smaller person. In this study, in these people, it dropped by almost 800 calories a day. That is a huge, huge drop. And it is more than you would expect from their change in lean muscle mass. And again, go to the Research Corner and you read all about it. But 6 years later, this is the most important thing, 6 years later, their BMR had not recovered. However, most of them had gained most, if not all, and some of their weight back. But their BMR had actually not only not recovered, it had actually gone down, continued to get worse. So why is that? How is this possible, and how is sleep associated with it? Well, short sleep and insulin have a close relationship. Here's a study looking at if you short sleep for 5 nights, 4 hours, again, that's pretty aggressive, but 4 hours for 5 nights, 30% increase in insulin resistance. And what that means is that your insulin level is going to be higher than they would otherwise. Cortisol, stress hormone, goes up 21% as well. There's another study, 25% increase in insulin resistance. What about hunger? So I notice when I have a bad night of sleep, whether it be from the baby or from call or whatever, I feel like I'm hungry. Am I just using that as an excuse, or am I actually more hungry? Well, while there are differences between hunger and cravings, true hunger is driven by your hormones. There's this hormone called leptin, and leptin is secreted by your fat cells and your gut cells, and it is secreted to tell your brain that you are satiated from what you eat. What you've consumed has made you happy, versus the opposite side, which is ghrelin. Ghrelin makes you hungry. So this axis can be changed with sleep. So here we go. Leptin levels with short sleep go down. Leptin levels go down, meaning that you are hungry. So your ghrelin levels are unchecked or not as well checked, and you will indeed have more hunger with short sleep. Interesting with this study, they asked about changes in stress or perceived stress, and these participants noted no change in stress. So they actually didn't feel like they were stressed out, but their hormones were different. Here's an interesting study by the same author looking at food consumption. So this was a very controlled environment. Imagine essentially going to a hotel, being told you can sleep 4.5 hours or 8.5 hours, and then they watch everything that you eat. But it was a buffet style. They weren't actually watched in person, but on video, and they monitored how much they ate. Those that had short sleep ate 300 more calories per day than those that didn't. This was across the board. They also biased towards eating carbohydrates. We'll talk about why. there were similar results with 5 to 6 hours of sleep. And I think that's more powerful because I think 5 to 6 hours of sleep, this is really common for a lot of people, sleep 5.5 hours. I did it for years. All right. And then this hormonal response to this thing called the hypothalamic pituitary adrenal axis. We don't need to know what that means, but the reality is these are stress hormones. So ACTH is secreted from your brain and it tells your adrenal glands to increase cortisol. So this study looked at just 2 nights of restrictive sleep. ACTH, stress hormone, goes up, cortisol doubled. Pretty impressive. And again, their stress perception was unchanged. They didn't feel like they were stressed out, but they had a 200% increase in cortisol. So behaviors might change, but they feel okay. They did notice that their appetite increased though. So this is also an interesting study. This is by Matthew Walker, and he wrote a book that I'll talk about at the end. So this is a functional MRI study. So what a functional MRI can do is look at the brain on an MRI scan, and it'll tell you where it's lighting up. So basically where it's functioning at the time that the scan is performed. So if you look at this picture, you can see this picture down here. So this orange part down here, this is the back part of the brain. And the front part, this will be the executive part up here. This is where good decisions, well, technically it could be bad decisions, but decisions in general are made. This part back here is more automatic. This is your Labrador brain. This is your primitive thinking. This is survival. This is shelter. This is eat whatever is in front of me. So what this study found is that if you had sleep deprivation, you used the back part of your brain to make your decision making about food. If you had a full night's sleep, you used the front part of your brain. So you can imagine which part of your brain is going to make a better decision when it comes to decision making on, gosh, should I put that brownie in my mouth? Or if I'm going to make a decision between this salad and protein source versus this lasagna made with highly processed noodles, which of these is going to sound better to me? So if you are trying to lose weight, sleep deprivation will result in a catabolic state, meaning that you're going to burn stuff. That can be good, but in sleep deprivation, you're burning more muscle. I actually pulled that study out of this talk, but there's a bias towards burning muscle mass with short sleep. And if you can lose weight like this, it requires tremendous willpower because you're fighting your hormones. You're fighting your insulin, cortisol, leptin, and ghrelin. You're fighting all of it. Whereas with a full night's sleep, you're still catabolic, but you're lipolytic, meaning that you're burning fat. You're burning your body fat, which is exactly what your goal should be. It enhances satiety because of the leptin ghrelin axis, enhances your immune system because of the deep sleep, protects your muscle mass, which is important in maintaining your weight loss, and then balances your glucose and insulin metabolism and can help you bring down symptoms of diabetes. So in conclusion, sleep deprivation will increase your appetite. It'll shift you from logical to primal food decision making. It'll increase your food consumption, make you want to eat more carbohydrates, increase your insulin resistance, which can lead to metabolic syndrome, prediabetes, and diabetes, increases your stress hormones and cortisol, and you may not even feel like any of that's happening. And that's probably the most important point there, is that this is why we can take sleep for granted, is because we may not understand that all these things are happening in the background. So you might say, all right, fine, I believe you, but I try to sleep. How do I sleep more? Well, let's talk about a few things. So this is a common thing that people do, is say, all right, doc, I'm gonna go to my primary care doctor. I need something to help me sleep. And they write you a script for Ambien. Well, as it turns out, these drugs are in a group of drugs called sedative hypnotics. Just the name of that drug group should give you pause to say, gosh, I don't really want to be sedated or under a hypnotic, or at least not every night. And that's exactly what these drugs do. They essentially take out the front part of your brain. They don't let you sleep. You certainly get very poor quality sleep, and they have a tremendous number of side effects. Ones that I'll point out to you: complex sleep behaviors. These are those things you hear about. My neighbor got in their car and drove to the grocery store and ran over somebody on their way and got charged with manslaughter. That's a complex sleep behavior, and that can happen on a drug like Ambien. Rebound insomnia is a huge problem. There are a lot of people that can't get off of these drugs. They're stuck on them. Decreased motor function and dementia. These are two big things, particularly in our older population. It's mostly related to quality sleep again, I think, and that's not been proven, but it's resulting in poor quality sleep, which prevents the elderly population from getting the sleep that they need to protect their brains. Alcohol. One of my favorite quotes of all time: alcohol, the cause of and solution to all of life's problems. So a huge percentage of our population consumes alcohol in an effort to help them relax and go to sleep at night. And it will do so. But you have to remember that it is a sedative. You are going to sleep, kind of. You are actually passing out, depending on how much you drink. It is an anesthetic. It is an antiseptic. As such, it is poison. Ethanol, when you consume it, your body says, whoa, you just drank poison. I got to get this stuff out of me. And it'll actually take your ethanol, it'll convert it to acetaldehyde, which is carcinogenic. And then it converts the acetaldehyde to acetic acid and acetyl-CoA. Acetyl-CoA is the energy component that gets fed into your cellular mechanics to produce energy. It does this as fast as it can. So from a metabolic standpoint, it will prioritize doing this over anything else. It increases your core body temperature, which plays a big role in your ability to fall asleep and improve the quality of your sleep. And we'll talk more about that. If you're trying to burn fat to lose weight, this will prevent you from actually burning fat, and potentially for 2 to 3 days, pretty big deal. And it hurts your gut lining. So it'll actually irritate and cause issues with your gastric mucosa, which may affect the way that you decide to eat the following day. And ultimately, it's highly addictive. It is one of the most addictive things in society. I would argue that alcohol and sugar are the two most addictive, socially acceptable things. All right, so here's an example of alcohol and sleep together. So again, this is my data. So this is my nice ideal night of 8.5 hours of sleep over here. This is me after a couple glasses of wine. And I'm not saying I drank an entire bottle of bourbon or anything. This is actually not that much alcohol, but look at what happened. So at 9 o'clock, I probably sat down to watch some TV and fell asleep. Not uncommon. Woke up, got interested in what we were watching, and then fell back asleep. And then I went to deep sleep. Actually, the most deep sleep I got all night long. And then I woke up and I fell asleep. Then I woke up and then I watched whatever it was because I'd gotten enough sleep to stay awake. And then I fell asleep, went to bed. Look at this. I got almost no deep sleep, almost none. If you look at the cumulative 25 minutes of deep sleep versus 2.25 hours of deep sleep, that's the difference that alcohol makes. For me, REM sleep's actually not that significantly affected. I've heard that for others, that's the opposite, that they see a bigger switch in REM. But for me, it plays a tremendous role on my deep sleep. And you can imagine if this was a regular habit, how terrible for you that would be. If you look at the resting heart rate, you can see the impact. So over here, my nice night of sleep, average of 44. Over here, on my alcohol-driven night of poor sleep, 77. 33 beats higher to burn off that alcohol. That's how hard my body is working to get that out of my system. Heart rate variability is something that the Oura Ring measures as a measure of a recovery from activity and stress and other things. So this is pretty high for me, 118. That's pretty high across the board, really. And you can see here with the alcohol, 23. And you can actually appreciate how bad, you can see how different they are, right? I don't need to get into what this means, but there's nothing happening here. And then this is where I'm probably, getting this alcohol out of my system. So you can just appreciate objectively the differences there. Caffeine. I love coffee. I know a lot of people love coffee. The challenge with coffee is that caffeine has a half-life of 6 hours, and there's some variability, but in general, it's 6 hours. And a half-life means that the amount of caffeine that you consume, 6 hours later, there's half of that amount still in your system. So then 12 hours later, it's a quarter, and then, so on and so forth. If you drink a lot of caffeine in the morning, so let's say, I'm having my coffee at 6 a.m., if I have a huge amount of caffeine, there's still a significant amount of caffeine in my brain when I try to go to sleep. If you're having caffeine in the afternoon or after dinner, there's a lot of caffeine in your system. You say, it's fine, I fall asleep after a cup of coffee. Probably you're really fatigued. But let's talk about why it's a big deal. So caffeine blocks adenosine receptors. Adenosine receptors, or adenosine in general, causes this thing called sleep pressure. It's one of the two things that will help you fall asleep. So your brain generates adenosine throughout the day. The quantity of adenosine accumulates, and then you reach a certain point, usually in the end of the day, where you say, I've had it, I'm exhausted, I gotta go to sleep. And that's called sleep pressure. Caffeine blocks the adenosine receptors. So it literally just pushes back on the adenosine until the caffeine wears off enough that the adenosine flows through. And that can be that wave of exhaustion you get if you're consuming caffeine to stay up. So caffeine blocks adenosine receptors, and that prevents that sleep pressure from occurring. This is an example of how much caffeine is actually in some of these products. So I love Starbucks coffee. That is 500 milligrams of caffeine. It's a ton of caffeine. That's in a 20-ounce. It would not be uncommon for me to drink, well, prior to knowing this information, 2 of these in the morning, if not more. So literally having a gram of caffeine on board, and then maybe doing it again after lunch. And that's how much caffeine a lot of people are consuming, and it is certainly affecting their sleep. So the rest of this came partially from the NIH, but this is online if you'd like to look at it. I've added a fair amount of stuff to it and some stuff at the end, but we'll flow through these recommendations. So sticking to a sleep schedule. I've listened to several different authors and read several books. The most common thing in between all of them is they say, number one thing you can do is stick to a sleep schedule. Same time to bed, same time to rise, even on weekends. Don't try to catch up. Just get good sleep every night. The reason for that is that your brain has to anticipate, because it biases deep sleep towards the beginning and REM sleep towards the end. Your brain has to anticipate that. And if you're shifting your sleep cycles all around, your brain doesn't know what to do with it. And ultimately, it has a hard time knowing when to do that. And it messes with how your brain lays out those cycles. And it's really hard to retrain. So if it hasn't messed it up already, try to just stick to a nice schedule. You can shift it a little bit without too much effect, it seems, but really try to stick to a similar schedule. It's one of the reasons why third shift workers have such a hard time with sleep, and why it's actually been labeled as a carcinogen. And some countries are actually working to give people benefits for people that have developed cancer that are third shift workers for the government. They realized how bad it is for you to shift back and forth your sleep schedule. Exercise. Again, love exercise. Not an exercise hater, but don't do it right before bed. Similar to other metabolic things like alcohol, it increases your body temperature. It makes it hard to fall asleep, makes it hard to stay asleep. Great, do it in the morning, work out as hard as you want, but recover before you go to sleep. Caffeine and nicotine. Nicotine kind of follows caffeine. It has a half-life. It's shorter. It gets out of your system faster, but it's still a stimulant. A lot of you are looking at this picture right now and saying, well, that's not caffeine or nicotine. I know what that is. So that's marijuana. There's a lot of effort to produce literature looking at both THC and CBD, its effect on sleep. And what I'll say about it is that I practiced in Colorado for several years and got a lot of feedback because it's legal. And a lot of people say that it helps. And ultimately, anecdotally, if it helps, that's fine. The literature doesn't strongly support it. And until I see literature that has sleep quality data, I would not encourage people to pursue this. Experiment, particularly, CBD seems to be, less of a big deal. But number one, know what you're getting. And number two, really pay attention and don't expect that it's going to be a panacea for sleep. Alcohol, I think we beat this one to death. If you're going to have a couple of glasses of wine or whatever, do it before dinner. Give yourself a good 5-6 hours to get that out of your system before sleep. Large meals late at night, ultimately, this is a metabolic demand too. It's going to increase your body temperature, going to make it hard for you to fall asleep. Also destroys your feeding window for those that are watching when you're stopping eating and beginning eating. Medications, a lot of different medication classes can be stimulants. If you're having issues sleeping and you're on some of these medications, I would encourage you to talk to your primary care doctor about when some of these potentially you could change the time that you take them or not take them and so forth, but don't stop taking them on your own. Naps. Naps are kind of an interesting thing. So naps can be a powerful tool. They are a great way to refresh yourself throughout the day. A lot of people really thrive on napping. Napping, though, will drain the adenosine buildup. That makes that sleep pressure that I talked about. It will drain the adenosine out of your brain. So if you nap late, for example, our elderly folks that nap after dinner when they should probably be in bed, that late nap will destroy your ability to get to sleep. So consider that after 3 p.m., you probably shouldn't nap. You should just stay up and go to bed earlier. Sunlight exposure. So this is the other way that our brain tells our body to go to sleep. Melatonin. A lot of us have heard about melatonin. A lot of us take melatonin supplements. So melatonin is secreted by your brain, and it pushes your brain to sleep. people will take melatonin to help that happen. Literature is mixed on how effective that is, but it will help with your sleep onset to some extent. Sun exposure and blue light prevents the release of melatonin. So you go outside, you get sunlight, your brain is happy, you're doing your day. Sunlight goes away, you take away your blue lights, and you have amber lights or dim light, and that encourages release, and that should allow you to fall asleep. Bedtime rituals is a big deal. How many people look like this at the end of the night? Blue light coming from machines is a big deal. Blue light coming out of your TV, computer screen, phone, whatever. That blue light prevents melatonin secretion, and it will prevent you from falling asleep. Screen time in general will stimulate the brain and prevent you from falling asleep. Work. If you're working hard, your brain's working, you're trying to figure out how to solve the next crisis in your business, that's going to prevent you from going to sleep. I would recommend that you close the laptop, write stuff down, journal about your day, journal about what you want to do tomorrow, and you can read it in the morning. Wind down your brain, ideally an hour before your set bedtime. Read an actual book, a physical paper entity. And if you do have to look at something, use blue light blocking glasses or screen settings. Both of these are now pretty much across the board available. If you can, just turn the darn thing off. There are some software out there. There is some software out there. I've been using this one called Iris recently on my computers. Really like that one. It is an inexpensive subscription base. F.Lux is free, but less maneuverable. And then bring your core body temperature down before sleep. So a little counterintuitively, a hot shower or bath will make your core temperature cooler. It does that by bringing the blood out of your core into your extremities. And then as you get out of whatever you're in, your extremities with all that blood out there will cool down your core body temperature. Ideally, according to the research, 65 to 68 degrees ambient temperature is ideal for sleep, which is pretty darn chilly. Your sleep environment, this is huge. So your sleep environment should not look like this picture. Do not take this as a recommendation. So again, blue light will block the secretion of melatonin. You should not have blue light in your bedroom, or at least not during the nighttime. Do not have a TV in your bedroom. It's a terrible idea. Do not have a desk in there. Your bedroom is for sleeping. If you can control noises on the outside, great. If not, block them from the inside with a white noise machine. Your lighting environment, amber lights or red lights. Red lights look a little weird, but amber is great. And then again, cool ambient temperature for cool body temperature. All right, some biohacks to go along with this. So EMF is electromagnetic field. This is some interesting research. It's a little bit out there still for me. I've got a book sitting on my shelf that I'm going to read about it. But basically, EMFs are generated by electric devices, in particular cell phones. So I have noticed one thing I've done recently for me is I used to keep my cell phone right by the bed on my bedside table. I'm on call for the hospital. I want to be able to respond to a call or a text without waking up my wife. Even when I wasn't on call, though, I would keep it there because that's where the plug was. And I noticed that once I moved it based off of a recommendation, my sleep immediately got better. Now, is that because of the EMF? I don't know. But if you can't move it, at least turn your sound off. If you can turn the cell part off, that'll take the EMF out, put it on airplane mode, or just turn the sucker off. And at minimum, certainly put it on silent or sleep mode, because that little buzzing, binging, whatever will destroy your sleep. Grounding and earthing, this kind of goes along with EMF in some ways. I have a book about this that I want to read too. But the idea is basically that your body, if we're not attached to the ground and we're insulated, whether it be in our shoes or our house or wherever, we are generating a positive ion balance. And this is proven from the research that I've read. The earth has a negative ion balance. And if you stand on the earth barefooted, you will pass your positive ions to your negative earth. And you can actually hold on to a voltmeter and you can watch that happen. It's pretty cool. So they make grounding mats or pads or whatever that you can put on your body or stand on or sleep on. They'll actually pass these ions out. I now have one of these on my bed, and I think that it does help. But again, this is a biohack thing. I haven't looked at all the literature on it yet, but it certainly can't hurt you. Binaural beats and meditations, and people will listen to these as we go to sleep. We have some of these in our client area on our website. There are some commercially available out there, and there's some free content out there as well. It's interesting. The research isn't great that I'm aware of, but again, if it helps, there's really no downside. Um, weighted blankets, cooling blankets, these are pretty popular. I've not played with either of these yet, and I'm not sure that there's a tremendous amount of literature to support it, but they are popular. All right, so CBTI, so cognitive behavioral therapy for insomnia. If you do all these things and you still can't sleep, you should seek help. Um, Cognitive behavioral therapy is actual therapy that's out there that apparently works really well. So you don't necessarily need to jump on drugs or some kind of psychotherapy. This cognitive behavioral therapy reportedly worked really, really well. And if you still can't sleep, I would encourage you to check it out. One of the lessons in this, I've read through it a little bit. The biggest one early on is don't lie in bed awake. If you're laying in bed and you can't sleep and you've been there for an hour, get up and do something. Get up and do something, fatigue your brain, and then go back to bed. If you train your body that laying in bed awake is what you do in bed, you will lay in bed awake. All right, last thing, circadian rhythm as we age. So this is pretty fascinating too, for me, particularly because of my kids right now. But so your brain secretes melatonin, as I've already said. It does it pretty predictably at different times at different ages. So, and when you're a kid, your brain will secrete melatonin. So my 7-year-old and my 6-year-old, they go to bed at 7:30, 8 o'clock, and they are asleep like that. And it's because their brain is flooded with melatonin and they're exhausted. As you age, that shifts. In fact, it actually shifts tremendously from childhood to teenage years. So teenagers, we want them to do the same thing, right? You go to your room and go to bed. You have school at 7 a.m. tomorrow. The reality is their brain isn't ready for sleep until midnight. So when your teenager's up there at midnight or 1 a.m., it's actually not their fault. I don't have teenagers yet. I haven't had this battle, but I know it's terrible that we make them wake up at 6 a.m. and go to school because they're short sleeping every night. And there are some countries which are actually extending and delaying start times based off of this because there is significant research that demonstrates short sleep with psychiatric disorders, behavioral issues, ADHD, and so forth. So I would be a huge advocate for looking at this research. If you're involved in a school and you're watching this, look at the research on short sleep and the fact that our teenagers are really getting shortchanged and they are all chronically fatigued as a result of their brain just not secreting melatonin. You really can't do anything about it. This pulls back a little bit as an adult, working age adult, and then in geriatrics, it's back to where you were when you were a 5-year-old. It's that whole circle of life. And again, if you are noticing somebody who's sleeping, doing a nap after dinner, and then having a hard time sleeping at night, encourage them just to go to bed earlier. They probably need to go to bed at 8, not at 10. And so in conclusion, fall in love with sleep. It's a biologic mandate for a reason. Provide yourself with a non-negotiable 8 hours of sleep every night, minimum. And for me, that would be 8.5 hours of bedtime to get 8 hours of sleep. Short sleep will increase your hunger signals, increase your appetite, compromise your impulse control, increase food consumption, make poor nutrition choices, decrease your feelings of satiety, and promote catabolic muscle weight loss, as well as destroy your immune system. Some devices, I mentioned these. So Aura, that's the OURA, that's their website on top over there. Whoop Strap, I also use. I find it's better as a fitness tracker than a sleep tracker, but it does give some pretty good sleep data as well. BioStrap, I don't know as much about, but it is another device that will keep track of things. And there's more devices coming out all the time. This is, I think, a pretty big market. This is the book I mentioned, Why We Sleep by Matthew Walker. Strongly recommend reading this. It's an easy read. He's actually also on a number of podcasts, which you could find him on. Peter Attia, that's Attia. The Drive has actually a couple of podcasts with Dr. Walker. I really like the way that he describes this stuff. And that's it. So thank you to Dr. Ashley Lucas, founder of PhD Weight Loss. Our PhD team, I really appreciate all you guys, and of course, the PhD family and friends. So that is the extent of the talk. I'm going to